In this video you can study teeth and dental prostheses and implant dental prostheses. The objectives of this presentation are to describe the anatomy, typology and function of natural teeth in the human dentition, to cast light on dental prosthesis, its main functions and the types of dental prosthesis that exist today, to analyze implant-supported dental prostheses by presenting their main elements and the steps in the associated treatments. The masticatory, or stomatorgnific, system consists of a series of anatomical structures the physiology of which is coordinated around the respiratory, swallowing, masticatory, phonatory and postural and mimetic functions. Teeth, certain bones, muscles, joints, viscera and integuments, as well as accessory muscles represented by the muscles of the neck, nape and shoulder girdle, make up the masticatory system. All these structures have a rich sensory innervation, whose function is to instruct the chewing and swallowing processes so that they work properly. This section provides information about the teeth, a component of the stomatorgnific system. The teeth are hard anatomical organs, whitish in color, implanted in the maxillary alveolar ridge and mandible. They serve chewing, speech articulation, aesthetic and facial expression functions. Each tooth consists of three parts: the root, the crown and the neck. The dentoalveolar joint is the fibrous joint between the tooth and the alveolar bone, which are joined by fibrous connective tissue. This type of joint is characterized by maintaining a continuous connection between the elements that bind, lacking movement. The temporomandibular joint is located between the condyle of the mandible and the mandibular fossa of the temporal bone of the skull. Both elements are connected by the articular disc and protected by the articular capsule. The mass of the tooth consists of dentine, which surrounds the dental pulp cavity. Crown dentine is covered by enamel, while root dentine by cementum. The bond of the enamel with the cementum at the tooth neck is called the amylocemental junction. The cementum of the root binds to the bone by the periodontal ligament, which together with the gingiva and the alveolar bone form what is called the periodontium. Dentine is yellowish calcified tissue that is harder than bone and has elastic properties that protect the overlying structures against chips. The color of teeth is genetically determined and comes from the dentine, which shines through the enamel. The dental pulp is made up of a soft tissue containing blood vessels that carry blood to the tooth, and nerve fibers that traverse the tooth root and provide sensitivity. The tooth enamel or enamel tissue is a translucent, shiny, impervious to much and very hard, as it is composed of hydroxyapatite, the hardest mineral in the human body, which is also present in bone. The cementum is a hard, opaque and yellowish coating that binds to the enamel of the tooth neck. It is the protective structure of the tooth root. The periodontal ligament is a set of fibers set in the alveolar bone at one end and in the tooth cementum at the other, thereby forming the kind of network that holds the tooth in the bone while isolating it from the bone. The gingiva is the oral cavity mucosa that is pale pink in color and covers the alveolar ridge and the cervical portion of the tooth. It consists of dense connective tissue that forms the seal around the neck of the teeth that protects the bone and the other supporting tissues. The gingiva consists of two parts, marginal and attached. The alveolar bone is the part of the maxillary bone that contains the teeth. Humans, like all mammals, have a dentition in which teeth are different and specialize in a particular function. This dentition is of two generations: the deciduous dentition, with primary, temporary or milk teeth, and a permanent dentition. In both cases, teeth are separated into four quadrants: upper right, upper left, lower right and lower left. According to individual function, the permanent dentition has four types of teeth. Incisors. Permanent dentition consists of the anterior teeth, which include 8 incisors, 2 in each quadrant, a central and a lateral incisor. They have a beveled edge and their main function is to cut food. They also play a role in aesthetic and speech articulation functions, as they are important in making lingual and dental sounds. The upper incisors are larger than the lower ones. Canines. Permanent dentition consists of 4 canine teeth, one in each quadrant, named in this way because they resemble the teeth of canids, e.g. a dog or a wolf. Shaped with sharp points, they are located next to the lateral incisors and are used for tearing food. They have great influence on facial aesthetics. In animals they are called fangs. Premolars. Permanent dentition consists of 8 premolars, 2 in each quadrant. They replace the molars of the deciduous dentition and do not appear in this dentition. They have 2 cusps and share the same function with the canines and molars. The first premolar has sharp-pointed cusps and shares the tearing function with the canine, while the second premolar has more blunt cusps and shares the grinding function with the molars. Molars. Permanent dentition consists of the posterior teeth, which include 12 molars, 3 in each quadrant, that do not replace any primary teeth. They have broad cusps 4 or 5 and are used not only to grind food, but also play an important role in the vertical dimension of the face. They are the largest teeth in the mouth, with the first molar larger than the second, and the second larger than the third. The third molar, also called wisdom tooth, usually appears between the ages of 16 and 20, but can come in at younger ages or much later, or even never appear. According to the Dictionary of the Royal Spanish Academy, the prosthesis is a device used to artificially repair a missing organ or part of it. We can therefore define a dental prosthesis as an artificial element used to restore the anatomy of a tooth for several teeth. The main functions of dental prostheses are restoring mouth functionality. The most important purpose of a dental prosthesis is to restore mouth functionality that has been lost due to one or several teeth missing or being deficient. The prosthesis must enable the patient not only to chew and swallow food, but also to be able to articulate speech correctly in order to communicate with others, and all without interfering with breathing. The functionality of the dental prosthesis will depend mainly on the type of retainer, the support device, and how stable it is. Preserving the health of the teeth. Besides functionality, another purpose of a dental prosthesis is to prevent further deterioration of the other teeth in the masticatory system. Dental prostheses restore the vertical dimension of the face by restoring the relationship between the maxilla and the position of the temporomandibular joint, and by distributing the stress that occurs during chewing, thus preventing the mouth from suffering mechanically, all while preventing potential risk that could endanger the health of the teeth or overall oral health. Achieving an aesthetically pleasing set of teeth. Aesthetics and good appearance are additional but equally important purposes of a dental prosthesis. The intention here is to achieve or regain a set of teeth with an aesthetic and natural appearance, considering the patient's age, sex, facial features and size, as well as the patient's original teeth. When making the prosthesis, the midline, the smile line and the canine line are taken into account. The artificial teeth are made in the same color and shape as the natural teeth, especially if the patient partially retains his/her set of teeth, in order to obtain satisfactory aesthetic results. In general, dental prostheses are classified into 5 groups. Removable dental prostheses. Removable dental prostheses include prostheses that have 2 common factors. A. The materials used are acrylic resins or other plastics, and B. The patient can insert and remove the prosthesis from the mouth. There are 2 types of this dental prosthesis. Removable complete prosthesis, full set of teeth, mucosa-supported dental prosthesis, and removable partial prosthesis when the patient still retains some teeth. Tooth mucosa-supported dental prosthesis. The plastic material conforms to the mucosa of the patient's oral cavity and serves as a basis for supporting the prefabricated teeth that are used to restore the proper functions of the human dentition. Removable metal dental prostheses. This is removable dental prosthesis made from a metal cast that the patient inserts and removes from the mouth. This prosthesis may be made only as a partial type, as it attaches to both the mucosa and some teeth. Fixed dental prostheses. A fixed dental prosthesis is a device used to repair or restore the aesthetic anatomy and masticatory function of a tooth decayed or damaged by cavities, chips, decalcification, abrasions or uncorrectable malpositions due to other procedures. It is also used to replace one or more missing teeth. Composite or ceramic resins, or precious and non-precious metal alloys are used for this. They consist of a structure and cosmetic coating. This prosthesis involves prepared teeth that act as support and on which the dental prosthesis is later fixed. Examples of fixed dental prostheses include dental crowns and bridges. Mixed dental prostheses. This dental prosthesis consists of a fixed part and a removable part attached by a system of anchors. Implant-supported dental prostheses. This dental prosthesis is supported on dental implants. The patient must first undergo a surgical procedure in which implants are placed that then serve as support for the dental prosthesis. There are two types of implant-supported prosthesis: removable or fixed. An implant-supported dental prosthesis is an artificial device used to restore the anatomy of one or more teeth, and it is supported on dental implants. There are two types of implant-supported dental prosthesis: removable or fixed. This figure shows the parallel between a natural tooth and a fixed implant-supported dental prosthesis. There are three main elements of an implant-supported dental prosthesis: dental implant, abutment and crown. In this phase, the dentist performs the tests needed to be able to plan the patient's personalized treatment. The most common tests are oral examination, medical history, radiographic studies, study models of the mouth, special X-rays, CT scans, etc. These tests can indicate the quantity and quality of the existing bone to decide the type and number of implants to be placed and the most favorable areas of placement. In a simplified form, the classic surgical phase consists of the following steps, which are taken by the dentist at the clinic. Placing the implant or implants. Implants are placed into the jaw slightly above the level of the bone. The screw is inserted into the implant to prevent gingival tissue and other residue from entering. The implant is completely covered with the gingiva. The operation lasts between 1 and 2 hours and is usually done under local anesthesia. The patient does not experience any major inconvenience, either during operation or after it. OSSO integration period. This period of time is critical so that the implants can remain permanently attached to the bone. The length of this period varies depending on whether the upper or the lower jaw is involved: 3 to 4 months for the lower jaw and 6 to 7 months for the upper jaw. During the OSSO integration period, the temporary set of teeth is often used to meet aesthetic demands. Connecting the healing abutment. Minor surgery, lasting between 5 and 20 minutes, is performed in which an incision is made in the soft tissue and the implants are exposed. Then the locking screws are removed and the healing abutments are connected to the implants. The function of the healing abutment is to generate a mucosal root connecting the dental implant to the prosthesis, as well as to ensure that the gingiva heals in a way that allows for maximum aesthetic results. Before continuing with the treatment, there should be a period of approximately 15 days to let the gingival tissue around the healing abutment to heal. Placing the permanent abutment. The permanent abutment, where the dental prosthesis will be attached during a later phase, replaces the healing abutment. The dentist takes molds of the mouth in order to make the dental prosthesis with the size, shape, color and fit that will blend in with the patient's natural teeth. Then the dentist sends the prescription for the dental prosthesis that the patient needs to the dental prosthesis laboratory so that it can be made by the dental technician. During the prosthetic phase, the patient will need to make 1 to 4 visits to the dentist, during which the fit, function and appearance of the new teeth will be evaluated, requiring the dentist to send the dental prosthesis to the laboratory whenever it requires design modifications. This phase usually lasts a month in total. Once the new teeth are in place, it is important to care for them so that the treatment lasts. Oral hygiene should be very rigorous, and patients should go to the recommended check UPS to have the status of the implants and dental prosthesis monitored. Check UPS will initially be every 6 months, and then annually. The dental prosthesis requires care and regular check UPS, the same as if it were a natural tooth. The treatment described above in the 4 phases usually lasts between 9 and 12 months. An alternative is to place the implant and the dental abutment in a single session, which reduces the overall treatment time to 2 to 4 months. This option is called immediate loading treatment, because the patient can start using the dental prosthesis to chew from day 1, but this can only be used in certain cases with patients who have sufficient bone mass and good bone quality. Teeth are organs in the masticatory system. Each tooth has 3 parts: root, neck and crown. The mass of the tooth consists of dentine, which encloses dental pulp cavity. Crown dentine is covered by enamel while root dentine by cementum. Humans have a dentition in which teeth are different and specialized. This dentition is of 2 generations, the deciduous dentition and a permanent dentition. According to their function, there are 4 types of teeth in the permanent dentition: incisors, canines, premolars and molars. Dental prostheses are meant for functional, health and aesthetic purposes. In general, dental prostheses are classified into 5 groups: removable resin, removable metal, fixed, mixed, and implant-supported. Implant-supported dental prostheses consist of 3 main elements: implant, abutment and crown. Dental implants create a stable and resistant support on which the dental prosthesis is fitted. The material currently used in the manufacture of most dental implants is titanium, because it facilitates osseous integration. The dental implants most commonly used today are cylindrical threaded and osseous ones, for which different morphologies, both macroscopic and microscopic, can't be found. The dental abutment is the part connecting the dental implant and the prosthesis. According to the method used to attach the dental prosthesis to the abutment, there are screw, cement, or anchor-retained abutments. Dental crowns are custom-made medical devices manufactured by dental technicians in the laboratory. The materials most widely used to manufacture dental crowns are metal, ceramic and combination of both. Traditional treatment with dental implants essentially involves 4 phases: research and planning, surgical phase, prosthetic phase, and maintenance. Immediate loading treatment shortens the traditional treatment duration, but is only appropriate for certain patients.